Welcome to Bay State Noble Hospital's Nursing Updates. Let's review some of the reminders as well as recent and upcoming updates here at Bay State Noble Hospital. Code cart check reminder. Please remember to check the code cart daily if your unit is in operation as well as after every use. We want to ensure that the daily defibrillator check is done and that the shock is verified to be within acceptable range. We want to make sure that it's plugged in and charging, that the defibrillator cables are attached, that there is adequate EKG paper, that the defibrillator pads are present but not open and not expired. We want to ensure that the electrodes are dated as well as not expired, as they expire within 30 days of being opened. We want to check to ensure that the oxygen tank is greater than 1500 psi, that the drawers are locked and intact, that the log is completed, and this is a high alert Joint Commission thing, so we want to make sure that this is done consistently. Also, that the weekly inventory was performed and any expired items was removed and replaced, and the code cart's drawers were relocked. Recently, Environmental Services has found several red biohazard bags in the regular trash cans. So we want to make sure that we dispose of this regulated medical waste in a proper receptacle in your work area. The hospital could receive significant fines if these items are not disposed of in a proper manner. You may have noticed some new insulin BD syringes on your unit. There are actually two. There is a 0.5 ml that should be used for all doses less than 40 units. This will allow for the nurse to increase the visibility of the scale markings to ensure an accurate dose is given. The standard 1 ml syringe should be used for all doses greater than 40 units. You will notice that this needle is shorter and thinner and should be less painful for patients. The safety is the same, and we should be able to activate that with one hand. Since this needle is shorter and thinner, for some patients you will notice you can go in at a 90-degree angle and you will not have to do the pinch up technique. I did leave the QR code here and we'll send the link for anyone that would like to learn more information. Within the next couple of weeks, the Bay State Health System will be eliminating water pitchers, more because of an infection control risk of these being in and out of the patient's rooms. So you will see a 32-ounce cup lid straw combination that will be single use. So once this goes into the patient's room, it will be disposed of upon emptying. And you will also notice perhaps some additional new products as they are trying to standardize the hot and cold cups as well as straws in the facility. A new device that you may see is the oxy mask. So this is a new option that we have to use for patients. You will notice that it is open, which allows for reduced claustrophobia, increased ability of the patient to communicate. We are able to suction with this as well as allow the patient to have a nasogastric tube. You will also notice this has the ability to provide 24 to 90% oxygen, which is similar to a non-rebreather, but as you can see, this patient seems to be tolerating it much more. So head to the QR code or the training link to learn more about this product. Any of you that have been with Bay State Noble Hospital for a couple of years, you may remember the Posey fall alarms. We will be replacing the blue AliMed alarms with these Posey alarms on Thursday, August 20th. These will be integrated where applicable into the nurse call system, so when that pad is alarming, so will the nurse call be activated. These will have chair and bed pads similar to the product we have now. When you do open the chair pad or the bed pad, you will notice that it has a little green grippy pad, which just prevents that pad from slipping around in the chair or bed. You will notice these are single patient use only, so if we do open them, there is a 30-day expiration, so they should be marked with the patient's name as well as the expiration date. To learn more about this product, you can scan the QR code, or the rep will be performing several live in-services for us. So you'll see the dates listed here, and these were sent out as well. So email me with one of the links for the times that work for you, and I will send you an invitation that will include the remote training link. It's approximately about 20 minutes, but she did allow for additional time for question and answer. With these pads, we have the ability to use tone, or we can record a voice. So you'll learn about some of the updates for this system during the training. You will notice that you have an additional web-based training assigned to you regarding patient person-centered care, which focuses on shared decision-making in action. So this really allows the patient to become part of the decision-making. In order to view this module, it is a PowerPoint presentation, so you will need a computer equipped with sound to be able to hear the module. The completion date for this web-based training is September 30th. Speaking of clinical competency and web-based trainings, please ensure that all of your web-based trainings are completed by September 30th. There is a link within NobleNet, or you can go remotely to www.educode.com/base-date and log in with your EN number minus the EN in your password. Due to COVID, skills validations have not yet been completed, but dates will be coming soon. We are looking to do a unit-based skills validation session this year, and then also ensure that you complete any additional unit-specific competencies assigned by your manager or educator. Lastly, I wanted to let you all know of a Grand Rounds opportunity that we have coming up on Tuesday, September 1st from 12 to 1:30. This was organized by our new ED chief, Dr. Sunny Shukla, and it has some really great topics, so I think you should all try to attend. This will be done remotely via WebEx. We have Dr. Seth Jemmy, who will be presenting us with a topic, high-sensitivity troponin. So our ED, as well as inpatient, soon will be doing a troponin test that's very different, that allows for higher sensitivity of true cardiac issues. We also will have the Chief Diversity and Inclusion Officer here to discuss leading with dignity, as well as a cardiologist discussing You Are Here, communicating from the heart space. So we will be having these Grand Rounds quarterly, so please join us for our first edition.